Good morning. This is Dr. Thomas Klein. I'm coming to you on my YouTube channel of myths. It's about myths in medicine. And one of the strongest myths we have is our pain medicines that have been used since before the pyramids were built has now been deemed to be radioactive and dangerous, and people shouldn't use it. It's all based on fear of addiction, and some people are more afraid of addiction than others. We had a patient who said, if I have a chance of becoming addicted versus taking care of my painful disease that completely disables me every day, I think it should be my choice to deal with addiction. Ironically, opiate addiction is different than others, and it can be detected immediately when a person has their very first opiate pill and they go to the moon. They have a cosmic experience. Most people don't have this. This is different to methamphetamine, where most people have some kind of, excitatory response, but not with opiates. 99% of people, when they take their very first opiate, nothing happens. Feel a little sick to their stomach, might feel a little relaxed, but they don't go to the moon with an intense euphoria. And if they do, then that's the signal to stop immediately and get treatment for your newly diagnosed genetic opiate disease. Well, today we're going to talk about a little bit of medical legal stuff. We're going to talk about abandonment. Now, you need to know that there's common law. Common law is based on previous decisions by judges, and it is not statutory law. So if there's no law, then if harm occurs from something, an action of another person, then this goes to court of common pleas, or it goes to courts of common law. This is the typical lawsuit. The typical malpractice case is actually in common law. And abandonment is one of the things that doctors get sued for because harm occurs. The key thing is harm. If something happens to you and there's no harm, you have no case. So, doctors abandoning patients. First of all, there has to be an established doctor-patient relationship to start with. So this is not turning down a new patient. The physician abandoned the patient when medical attention was needed. This is very important. This means that ongoing treatment was needed. And it's kind of critical treatment. For example, if you come to me and I treat your high blood pressure with a pill you take every day, and then I abandon you, I say, well, I don't want you for my patient anymore, you can't really sue me because there's no real harm. And it's easy to find another doctor. But with somebody on insulin, or somebody on blood thinners, or somebody taking opiate pain medicine to allow them to function during the day with their long-term painful diseases, that's real abandonment. You're abandoning somebody who's on critical treatment while medical attention was needed. The abandonment occurs abruptly, preventing the patient from finding a replacement, and 4, the patient suffered an injury as a direct result of the abandonment. So if a doctor says, I'm not going to treat you anymore with your pain medicine, even though you've had a 20-year history of increased function, and now, after having it stopped, your life falls apart, that's harm. So any physician that abruptly stops you and causes harm is a candidate for a lawsuit. Why don't doctors want to do this? Because they're afraid that the anti-opioid fervor in the country would make it difficult to prove the case with a jury. But lawsuits can be filed and settlements can be made which should interest you trial lawyers out there, and you'll be doing a good thing. There's really nothing worse than purposely stopping a person's pain control medicine. If there's no other drug available, no other doctors available, which is the case. So that's what abandonment is. And you're going to call up a lawyer. I don't know that they'll just take your case. The best thing is to have your own lawyer listen to your case, and then the lawyer will call the trial lawyer. If you don't have a lawyer, find an older independent lawyer who's had a lot of experience and go to them and get a will written. A couple of $100 to get a will written, but now you have a lawyer. Lawyers are like doctors. You know, once you're a client in the law office or once you're a patient in my office, there's a certain relationship that then is expected. And it's expected that if you have a lawyer who drew up your will, that if you asked to come in and speak to them about this problem of abandonment, they would probably listen. So it's time to have the lawyers involved because they can do good. They can stop this abandonment. CDC claims that, oh no, we're not, we don't have these regulations. So they doubled the size of their regulations from 50 to 100 pages, and that makes it impossible for anybody to read. And they abandoned the 90 milligram cutoff, which was illegal. It was turned down by the FDA, and that's culpable in itself. And now they're talking about a 50 milligram danger zone. Just, if you're going to go over 50, be real careful. What's the message? 50 milligrams is a dangerous level. 50 milligrams per day